Welcome to the latest edition of Dynamic Political Centrism, hosted by Alan Steinberg, produced by Dr. Yonatan Yoni Yaris.
Our guest, Linda Schwimmer, President and CEO of New Jersey Healthcare Quality Institute.
Good evening and welcome. I'm Alan Steinberg, the voice of Dynamic Political Centrism. Our podcast has become a major center of discussing political and policy issues in the Garden State. But tonight we're very, very fortunate because we have on as our guest the President and Chief Executive Officer of the New Jersey Healthcare Quality Institute. I always have to memorize that title, but that institute is a tremendous source of good for healthcare policy in our state. And their president, Linda Schwimmer, is the go-to person in the state of New Jersey for people on healthcare issues. Now, I want to start off before I introduce Linda by really stressing the importance of entities like the New Jersey Healthcare Quality Institute. Everybody thinks of public policy as being the exclusive province of legislative staffs, of political figures. The fact is that some of the best healthcare initiatives in the country come from the nonprofit center, nonpartisan entities like the Healthcare Quality Institute, because they research these topics in depth. They don't have any political agendas. They certainly are excellent sources of testimony before legislative hearings, and Linda has done that. So in this era where healthcare issues are so prominent and so unresolved, I would add, having Linda Schwimmer on as an authority on these issues is a real blessing for us and is a real feather in our cap. So Linda Schwimmer, the president, welcome to our podcast.
Thank you, Alan. Thank you for that warm introduction. It's a pleasure to be here.
Well, it's a truthful introduction. And I think we should start off, first of all, by talking about you and then talking about the Healthcare Quality Institute. Linda is like me. She's a licensed lawyer. I don't practice law anymore, although I still have a license. And I use the law degree to help me question people on legal issues regarding policy topics. But Linda is also a lawyer. And Linda, whenever you hear her discuss a healthcare issue, it's authoritative. So why don't you tell us about your background, where you grew up, and how you got into the healthcare issues?
Absolutely. Thank you. Thank you for that tee up. As you mentioned, I am an attorney. I do not have a clinical background, but I got into law because I was always interested in public policy. I worked originally for the federal government for what's called the Pension Benefit Guaranty Corporation.
Oh, I know that one.
It's an obscure federal agency that guarantees pension plans, defined benefit plans. And I think that there are a lot of parallels one can draw from looking at the pension industry and the pension programs across our country and the healthcare system. So maybe we can talk about that either now or at
I
some
do
point,
want to talk about
point
that.
in time. But yeah, so I worked for the federal government originally in DC, moved to New Jersey, and I practiced bankruptcy law actually for a long time here in New Jersey. And I saw a lot of the issues that both individuals and small businesses in particular were facing and things that were causing them to have to file for bankruptcy. And I could help them or their creditors at that micro individual level. But what I was always really interested in was changing policies and making things better fundamentally, structurally. So I ended up leaving my law firm and I went and worked for the state legislature and then for our Department of Banking and Insurance. And I really focused on a lot of the laws that looked at our banking and insurance industry. And that was my entry into healthcare originally, was through health insurance and health insurance laws and a lot of the consumer protection laws and regulatory laws over the healthcare industry and as well as licensed healthcare providers. Then I worked for Horizon Blue Cross Blue Shield for a number of years when they were trying to move the healthcare system from a fee-for-service system to more of what's called alternative payment models, or payment models that really look at outcomes and try to pay for delivering better care. And then I joined the Quality Institute, and I've been here as CEO for over 10 years now, working with my colleagues to improve the safety, quality, and affordability of healthcare for everyone here in New Jersey.
I have to tell you something right now. We could do a whole show just on your biography, and it is comprehensive. I have to tell you something. I don't hold anything back when I do interviews, okay?
Great.
Your background is just incredible because I just turned 75. I look like I'm 75. I have an extensive background, but it took me a lot of years. You don't look anywhere close to 75, and your background, you're like a
Well, I'm
major.
not, so that's good.
I know. I know. You look like you're about 40 years younger than I am, and yet you have compiled a background that is very rare. I got to ask you some questions on it. When you went to work for the legislature, for whom did you serve?
Uh, Actually, Senate President Cody
Sure.
had just become governor. This was around the time when Governor McGreevey stepped down.
Right.
And Senator Cody took a lot of his staff with him over to the governor's office. And I started working there, staffing what was called the Commerce Committee. So it was a good
I
opportunity.
served at the New Jersey Department of Commerce when it was in existence. So
Oh, okay.
you and I have some. I have to say this. I always give my political observations. You're a part of a 501c3, so it's more difficult for you to do that. But I have to say that Cody was a very good governor for the time he was in office. He was an exceptional governor. I always thought he made a mistake. I don't expect you to comment on this. He never should have let Corzine get that nomination. He should have run for it himself. And that's the one mistake because he would have been one of our very good governors. And he was focused on healthcare very much, as I recall. He
Yeah.
was focused on a lot of things. And, he served so many years, so without scandal, without, and in a really comprehensive way. And his book, Me Governor, was very entertaining.
Mm.
It really was. But going back, I want to talk a little. You've given me so we could make the show 2 hours, but you wouldn't have the time. But the Pension Benefit Guaranty Corporation, I'll tell you how I first became aware of it. I have an LLM degree in taxation from Temple University, and the Pension Benefit Guaranty Corporation did excellent work. This is not a criticism, but it is a wish looking back on it. I knew of pensions that what the Pension Benefit Guaranty Corporation really did was guarantee that pensions would be solvent, but it didn't cover all pensions. And
Right.
my father was in a pension that went belly up. And I always, he somehow survived all that, but he was a manufacturer's representative in the clothing industry. And I always felt that the Pension Benefit Guaranty Corporation should have actually been expanded because it's fascinating that you work there and you also have been in a healthcare because for a senior citizen like myself, I'm able to live a comfortable life. My pensions are state pensions. I don't think the state is going belly up. I hope not. But I have state and federal pensions. I have Social Security. These things are necessary to live a comfortable life in our society. And
Yes.
I think that, but so is healthcare. I'll tell you something. Every time I go to my doctor, I thank Lyndon Johnson. And the reason I thank Lyndon Johnson, a very underrated president, the Vietnam War was a problem for him historically, but what he did for civil rights and healthcare was monumental, monumental. And every time I go to my doctor and I don't have to pay when I leave, and I don't have to pay, I also have supplemental health coverage. All these things cost, but I can live in peace because of all this. So, because of pensions and because of healthcare, your expertise, I feel, is essential for good quality of life for senior citizens in the state. So,
Yeah.
you're doing the Lord's work, so to speak.
Well, thank you. I will agree with you that I think Senator Cody or Governor Cody did a lot of good things for healthcare. He got through the no smoking laws, no indoor smoking laws, which we take for granted now, but have made such an important difference in people's lives and in workers' lives. And another thing that he did was he really started talking publicly about mental health and postpartum depression.
Yes.
in a very open way and really reduced a lot of stigma around both, which we still have too much stigma around both. And so I give him significant credit for both of those things because those are culture change, and a lot of things in healthcare pushing change through is about culture change, and he wasn't shy about doing those important things.
Well, I'll tell you, his wife, Mary, did a tremendous amount of good there
Yeah,
by going public about her postpartum issues. It took
yeah.
courage. It took a strong degree of integrity to do what she did and what he did. And you're absolutely right. That he did a lot of good things. He could be a difficult guy at times because I crossed him a couple times. I was actually wrong, but I was in the height of my I was a Republican then in the height of my political partisanship. And when Donald Trump came on the scene, I left the Republican Party. And now I am the most hated anti-Trump journalist in the state. That's something I take pride in, but that's neither here nor there. But I'll tell you something. He was right, but he wasn't abusive. He really was out for good, and your service to him is a real credit to your career, along with all the other things. So right now, the Healthcare Quality Institute covers a lot of aspects to it, but give us something about the history of the Healthcare Quality Institute, because whenever there's a healthcare issue in New Jersey and I'm looking for expertise, your website it's a Hall of Fame website.
Thank
And,
you.
and your blogs and everything, it's an education just to go to your website. It saves
Sure.
me from reading a couple books, you know.
Well, thank you.
But
I
tell us about the history of the Healthcare Quality Institute and recent substantial accomplishments, particularly what you've done for dental care for children in Medicaid families.
Sure, sure, sure. So the Quality Institute has been around for 27 years. It's interesting. Actually, we were born out of a group called the New Jersey Payers Coalition. That might even sound familiar to you. It was a group of union funds that were purchasing health care for their members, literally
Mm-hmm.
the members of their unions. And the costs started, this is way back in the 80s, the costs were starting to go up and up around hospital costs in particular. And they had no look into what was the quality across these different hospitals that were starting to charge very different pricing. So they wanted to get a sense of where they should be sending their members to and what was the quality and safety of these hospitals. And they really didn't have much in the way of data to do that. And so they started to dig into this and started to do some more public policy work and decided, they were not public policy folks. They were people who were trying to run a union fund and purchase healthcare benefits. So they created the Quality Institute and spun us off as a 501(c)(3). And we've been in existence ever since, looking at things like how to make healthcare safer, more transparent, of higher quality, and more affordable. We've changed a lot since then, but that was really the spark of our beginning. And then since then, we take on different initiatives. It's a combination of what we think are the most important initiatives based on the expertise of our staff, but also the guidance of our board. We have three former health department commissioners of health. We have a former commissioner of banking and insurance, congressmen. Like we really do have healthcare providers of many different types. We have a stellar board of experts. And then we're also what's called multi-stakeholder. We have all of the different stakeholders in healthcare in our membership. And we ask them to come to our table, to take their industry hat off, and to really work together on ideas and initiatives that are going to improve quality and affordability for everyone here in New Jersey. So not looking at it with their particular interests, but with the overall interests of the patients that they serve.
Well, that's why the Healthcare Quality Institute, for my purposes, as a person who is a journalist trying to get to the bottom of healthcare issues, you have more credibility than anybody else. Because if I go, let's say, to a lobbying group that lobbies on healthcare, that's all to the good. I applaud their work too. I mean, I may these are different stakeholders fighting with each other a lot of times in terms of priorities. But if I need the big picture, I will go to Linda Schwimmer. I will go to the Healthcare Quality Institute. I may agree or disagree, but you have 200% credibility. So that is why I think that your continued activity is so vital to the state of New Jersey, and why, being in the political world that I'm in, and when I talk to legislators, when I talk to cabinet departments, I know that you're looked upon, you personally and the Healthcare Quality Institute are looked upon with total credibility. And I actually think that's harder to find in Washington than that is in New Jersey. I was going to ask you, whom do you interface? Because healthcare is going to be a huge issue in New Jersey in this election. I think all the chaos going on in Washington now has put healthcare front and center. But are there any healthcare nonpartisan groups that you interface in particular with on national issues?
We do work with a lot of groups on national issues. One of the groups in particular is the Leapfrog group. I'm
going to get to that. They're the best. Go ahead.
Yeah, thank you for that.
You're the champion leapfrogger.
The Quality Institute is the regional leader for New Jersey and also actually New York for Leapfrog. And I'm serving right now, I have the honor of serving right now as Leapfrog's board chair at the national level. But Leapfrog is a group that asks hospitals and ambulatory surgery centers, or ASCs, to report on their survey about the safety of their facilities. They collect that data on an annual basis. They review the data. They provide safety grades to the hospitals. They grade the hospitals whether or not they fill out the survey, because they have additional ways to get data about these hospitals. But this goes back to really the origins of the Quality Institute, that we want to have the data, publish the data, and publish it and communicate it in a way that consumers and other purchasers of healthcare can really easily understand. And then when they're making a decision about where they're getting their care, or where they're taking their mother or father or somebody else to get their care, that they can be informed about the safety of the facility they're going to. So we are really proud to work with them, and it's a big part of what we do.
Well, I want to tout you for something, and I found out about this in the course of researching for this podcast. As I understand that, I know this for a fact because years ago I had a cataract operation, and I had it at an ambulatory care center. There was no hospitalization. But as I understand it, you are really at the Leapfrog Institute and at the Healthcare Quality Institute, really focused on the quality of care that is given at these ambulatory care centers, to make sure that people who are having their surgeries there, and they're going to be in and out the same day, that nothing is being neglected, that all due care is being exercised. Why don't you describe a little of what you're doing in that area? I think it's so important.
Sure. So New Jersey is the only state in the country that has 100% of its hospitals and hospital outpatient departments reporting to Leapfrog. So what that means is New Jersey residents have a lot more information about the safety of those facilities than anyone else in the country, which is fantastic. And I definitely applaud all the hospitals for participating in the survey. Right now, we are working to get the ambulatory surgical centers to also participate on Leapfrog survey. It's a little bit it's a little more difficult of a climb because they don't have electronic health records like the hospitals have. They don't have the same level of quality staffing that the hospital has in terms of like having a dedicated person to do that kind of reporting. So we're working with them, and we're going to be doing some coaching and hand-holding to bring them along. And we'll give them some time, but we do want to see all of the ASCs in the state reporting into Leapfrog eventually. And that's really what I've been calling for and pointing out, because today we do not know, we do not have any information that consumers can rely on, public, independent information about the safety and quality of the facilities. And we need that kind of information. More and more procedures, cataracts, like you mentioned, but others are going to be not going to be done in hospitals. They're going to be done for the most part for most people in ASCs, which is great because many of them, and probably most of them, are very safe, and they're definitely less expensive. But we don't have enough information about them. So,
Well, don't you think then, as I understand it, one of the great things about your institute, like I said, is the website and the fact that you folks really have expertise in using the internet and recording things digitally. Are you folks going to focus on how these ambulatory care centers can get into the digital world so that you would have better information, the consumer would have better information? It just strikes me that this ought to be a priority. Maybe I'm wrong, but that just
yeah,
strikes
no,
me that way.
it's definitely our priority. It's also something that we've been talking to the Department of Health about. I think it should be their priority. Um, they regulate these centers, and if the centers were regularly reporting to Leapfrog, it would basically be a early warning system for them. They don't have enough staff, and they would be able to see which are the centers that are doing really well, which are the centers that are having issues, which are the centers that aren't reporting at all. So it's a bit of a black box. Maybe we should look into that. Um, it would be helpful to them. And this is, again, we work on a regular basis with New Jersey regulators. We have the same common goals as they do. We want care to be safe and of high quality for everybody here. So this aspect of the work we do is a work in progress, but it's something that we're pushing on a daily basis.
Well, I read your report that you did on dental care
Oh
or the
yeah.
lack of dental care.
Yeah,
I
yeah.
had to salute you guys after I read this
Oh,
because
thank you.
no, I mean it. I
Uh,
don't give I don't give insincere compliments, and I don't hold back on criticisms either. But I have to tell you, I read that report. First of all, I was shocked. I
yeah,
was shocked that children in Medicaid families that they are just not getting proper dental care, and the consequences for these children growing up are going to be horrific. And
yes.
I was just in shock of the state of dental care of Medicaid patients, and no one else was doing the work that you did. Now, my question is describe a little bit of what the report said for our listeners, but also what are your next steps going to be in this area of dental care for children of Medicaid subscribers?
Yeah, yeah. No, no, thank you for raising that, for asking. So we've been working with a group called Kindersmile Foundation. They're a wonderful group of people that provide dental care to children, regardless of what type of insurance, or even if you have no insurance, and they'll provide it on a sliding scale if you don't have insurance. But they really alerted us to this issue originally, and then we started to dig into it. And the national recommendations, every organization there is, CDC, American Academy of Pediatrics, the American Dental Association, they all say that once a child starts to have teeth, even the baby teeth, um, they need to see a dentist. And particularly here in New Jersey, when we have such low rates of fluoridated water, it's really, really important. You need to prevent any kind of dental decay from starting to develop, because once it gets into the gums, it can get into your bones, and it can become, believe it or not, life-threatening. Something that is as simple as just regular hygiene. If you don't practice that, it can become life-threatening. And that's what's happened to too many children in New Jersey who are insured through Medicaid. So what we did, we had been told that not enough dentists were listed in the insurance companies' directories actually would see young children, even though the managed care organizations, the insurers, are required to have a directory just for young children. They're required to connect all of their members that they get paid to cover. They're required to help them get connected to a dental home by the time they're age 1. Um, what we did was we took every single dentist that were in their directories. We called all 840 of them, and we found that only 49% of those practices would actually see a 2-year-old. We did a secret shopper survey pretending to be a mom trying to make an appointment for her 2-year-old. And 51% of those practices would not even see a 2-year-old, would not make an appointment. And 37% of those practices did not take the insurance, that even though they were listed in that insurer's directory. So it really pointed out that we have a program. It's supposed to be providing certain services. We're paying for that as taxpayers. People in New Jersey are relying on it, and the care is not there. It's a ghost network. So you asked me what we're going to do about it next.
Yes, I'm following this. This is
Yes, so we have shared this with every single agency there is that has any kind of touch on this, everything from Department of Health, the Medicaid office, Department of Education, many. We've shared it with many. We have shared it with all of the health plans. We've given them their own data and our findings. We have we've put out press releases about it, and we've looked at what are the reasons behind this. And one of the big reasons is that the rates that the plans are paying to the dentists, they have not been fundamentally changed since 2007. So that's a
well,
long time ago.
I was going to
So
say the dentists aren't. I'm not here as a tribune for the providers, but they have to make a
yeah,
living off this. And if these
yeah.
reimbursements are that low, the program's going to fail.
Right. So the reimbursements are way too low. There's also not enough public education, and even within the dental practices, not enough education about the need to treat these kids starting at age 1 and the importance of it. So it's going to be a combination of getting the state to raise the rates, public education about the importance of early dental care, um, and getting Medicaid to enforce its contracts with these managed care organizations. They have many carrots and sticks. They have not used them as well as they should have been, and now we're going to be a watchdog, making sure that this issue is raised at every single Medicaid meeting. They have quarterly public meetings, every single meeting until they get their act together and do something about this, because this affects kids' entire lives, how whether they show up in school or not, what kind, whether they're able to smile, whether they're able to focus in class, and really just their overall self-esteem. So it's important, and it's important to us, and we're gonna make sure that we see change. And I'm hoping that we get that changed in 2025.
Well,
That's my
you are the public watchdog on that, and we're
I am.
seriously. No, seriously, we're reliant on you. I want to mention something else about Medicaid. It's very personal with me. My mother contracted Alzheimer's back around 2008. Now, my parents were living in Florida at that time. Florida is the land of Medicaid. I mean, it's amazing. When senior citizens run out of resources, Medicaid is a source of funding. I don't know how it works that way in New Jersey, but I am very grateful for one thing. Well, a lot of things, but the financing of necessary care for senior citizen Alzheimer's patients rips families apart. It really does, because people say, I don't want to pay for this. I was very fortunate that my sister and I did not have these disputes. But I had power of attorney over my mother. She was down in Florida, but we were running out of resources. My father had passed away, and we were using his life insurance policies. We had to sell the house that they lived in. I also ended up going to a Medicaid counselor. Medicaid counselors in Florida is a big industry. I'm sure if you ever wanted to retire and move to Florida, you could do this on the side and you would have all the expertise. But I had a very good Medicaid consultant, and I had to do things like I had to take a salary from her resources and report it as income on my income tax return. And I had told my sister was very cooperative. I had told her that when we had a certain reimbursement from Medicaid, that I would make sure that she had enough from that reimbursement to make up for the fact that I had gotten a salary. So that's the personal part of the story. We worked all this out. And as a result of which, my mother had been in a nursing home and it was not qualified under Medicaid. I had to find her a qualified home. We found it at actually a Jewish community care center down in West Palm Beach, and it was able to live a quality life in the last year of her life. And it's really horrible to watch a person who has Alzheimer's disease, just really, deteriorate. It was a terrible thing, and it's an experience that has motivated me to be involved in the cause of Alzheimer's patients. But in any event, while she was going through all this, Medicaid took care of everything. But I called my sister yesterday. I said, I just read something about cuts that they're going to make in Medicaid. That means that we could have never done for mom what we did. And I'm very worried about that. What is your focus on the kind of cuts they're talking about for Medicaid in Washington? I'm scared to death. I really am. I don't exaggerate.
I think that everybody who's familiar with the Medicaid program and anyone who's in state government who is trying to balance a budget is very worried about what's being discussed. It's still a little bit early, I think, to predict exactly where it's going to go, but the early estimates of what their plans are quite scary. It would mean the couple proposals that are out there now, they're looking at reducing. So let me back up a second.
Take your time. This is important.
As part of the Affordable Care Act, eligibility, who was eligible for Medicaid, was dramatically expanded. So it meant that a lot of people, particularly people who are single, so no kids, not pregnant, not the seniors like your mom, but people who are very, very low income, below 138% of the federal poverty level, but much lower than that, were not eligible for. They were not eligible for Medicaid. So the Affordable Care Act allowed states to go up to 138% of the federal poverty level, which is still not very much.
I remember we had to get my mother's assets down to below $2,000. That was the standard at the time. I learned more. It was a sad time for me personally, but I learned more about Medicaid. I could have gone to school on this stuff. It was
what happened is the federal government now pays 90% of the costs of insuring what's called the expansion population, the people that were added to Medicaid. The proposal is to eliminate that expansion. And if that goes through, what it would mean in New Jersey is over 500,000 people would lose their coverage.
Oh my.
It's a lot of people, unless New Jersey decided to pay the full cost of that. But that would be very, very hard for New Jersey to do. That would cost us several $1 billion a year.
Where are we going to get there? There's no way in this political climate of anti-tax and anti-government, there is no way that we will be able. All my years of politics tells me that There is no way that we will be able to fund that gap. I think this could be horrific in terms of senior citizen quality of life.
Well, right. So then the issue goes like, okay, if you have a Medicaid program and it now is losing $2 to $3 billion a year, how are you going to make that program work? Are you going to push off groups of people? Are you going to reduce the types of care? Are you going to reduce further that low reimbursement that all those dentists, primary care, mental health, other people, you can only reduce the amount that you're paying to all these healthcare providers by so much before they'll say, no, thanks, I'm not going to take care of people in Medicaid anymore. It's
Right.
just, at a certain point, it's an unrealistic ask. So that's the issue that is coming to a state near you this week or next or the week thereafter. I mean, that's the argument. That's the big debate that's going to be in Congress. And the question really is, because this is going to hit every state, red and blue, the question really is, are state representatives going to stand up for their states and their state budgets? And are they going to go along with this? And what's going to happen? Because this is not a small thing. This is a direct attack on every state budget in the country.
Well, I'll
it
tell you what this
impacts-
means
Yeah.
to me in a political sense. And I don't wish you to comment that because I worship your 501c3 status, okay? But I can. And I'm going to tell you something. Right now in Washington, Donald Trump is running roughshod over the members of his party in the House of Representatives and the Senate. They are going to have to, and that goes for our representatives in New Jersey, they are going to have to stand up on this issue because otherwise, in terms of quality of life for seniors and for younger people who may have been financed, by the initial expansion, this is going to be catastrophic. And I expect that it is going to be a major issue in this November's gubernatorial campaign. But I don't know, maybe I'm being naive or unimaginative. I don't know how you finance a gap like that in New Jersey.
Yeah.
I mean, people are already complaining about property taxes, justifiably so. They're complaining about income tax. They're complaining about sales tax. We are taxed to the very limits of what we can afford. Are there any states that have filled gaps like this coming up with inventive sources? Because I don't know what the heck you can do about a gap like this, and it's catastrophic.
No, I don't. There's no magic money tree to shake anymore that's left. We've cut them all down here in New Jersey. I think you're right. This is going to be probably the top issue for the gubernatorial candidates on both sides of the aisle. I mean, it's
I
really,
agree.
like I said, this is not a red or blue issue. This is a gigantic hole in our state budget if Congress decides to go in this direction.
It's not ideological. It's a matter of basic affordability.
Yeah.
And healthcare is already a big burden for comfortable middle class families. I have to say, I remember when Medicare was first enacted. Again, I salute the late Lyndon B. Johnson back in 1965, and it wasn't accurately portrayed at the beginning. It sounded like something that there was a program at that time called the Kerr-Mills program, and Medicare is substituted for that. But it was the idea was, this will provide for needy senior citizens, but that wasn't the glory of Medicare. The glory of Medicare was that it provided for all senior citizens, and it really was the greatest factor in the upgrade of healthcare in American history. My understanding, correct me if I'm wrong, is that the great bulk of healthcare expenses in America is devoted to the care of senior citizens. Am I correct on that?
Yeah, we spend a lot more in the end of life than any other type of care, for sure.
But what can be done, in your view, to provide for the families who are middle class, who don't want to have to confront this horror show when they're seniors, so that they have adequate insurance down through the years? I mean, if you're in a group, it helps, but your smile speaks volumes. Okay.
Yeah, we at the Quality Institute, we have put together a lot of reports and recommendations. We've We've worked on making changes in the commercial insurance market. So whether you're in the what's called Obamacare, the ACA market, or a small employer markets, we've made a lot of recommendations around how to make those markets more efficient. And we've also made a lot of recommendations for the state for its state health benefit program. There are things, you know, there's a couple things that are out of the state's control, like for instance, the the cost of pharmaceuticals just continues to rise. There's fantastic life-saving drugs, and they're very expensive. And it's hard for the state as a state to really get into those issues and regulate things the way you could at the federal government. But there are things that the state can do when it's a large purchaser of healthcare, like it is for state employees and all the locals, the police, fire,
Mhm.
teachers. When you put them all together, it's a very, very large group, which could have a lot of buying power. And the state, in my opinion, has made significant tactical errors in terms of how it ignores its buying power and is not managing the state health benefit program the way I think it could to get that the maximizing that buying power. So that is something the Quality Institute's going to be putting together some recommendations on for the next governor, because again, whoever that is, doesn't matter the party to me. That is an issue that is a huge part of our state budget, in addition to the Medicaid portion of the budget. And then I guess the other big thing I would say is that New Jersey could do a lot better job investing in the real fundamental type of care that keeps people in the healthcare that keeps people healthier. We talked about dental health. That's one of them. Mental health, primary care, preventive care, vaccinations, things like that. Um, we tend to put dollars behind and fund the programs and the groups that have the most effective lobbyists and the most power in Trenton. But that doesn't mean that they are the most worthwhile, cost-effective programs. In fact, sometimes they're not.
Oh,
Uh,
do I
but
agree with you on that?
but unfortunately, that's how things get done in Trenton, but that is not good public policy when it comes to healthcare. And so again, we'll be providing our recommendations to get candidates on both sides of the aisle on this topic. And I hope that they'll make some changes, because between Medicaid and the state health benefit, between our pensions and our healthcare costs, other than the debt servicing, those are the big buckets along with school costs. And school costs, a lot of those costs go back to healthcare costs. So they have somebody's got to start taking these things seriously if we're ever gonna hope to make New Jersey a more affordable place to live. It's a wonderful
Well,
place to live, but it needs to be a more affordable place to live as well.
every candidate is under the mantra now of affordability. Okay.
Yeah, but
But
you
they're
know,
not they're not putting their money where their mouth is. And you have brought up two very important things. And for the rest of the time we have, I want to focus on this. Number one is when you talk about being efficient, and in effect, what you're saying, and I could not agree with you more, is the ability to negotiate overall. That finally Medicare did this in Washington with prescription drugs. Finally, and I've got to say this. I am a personal. I always bring myself into this because I know myself. I'm 75. I've had two conditions down through the years, and I'm in the best health of my life because of prescription drugs. I've had adult diabetes, and I have also had irregular heartbeat. Today, they have medications for these conditions that really enable you to live day to day. But if I could not afford these drugs, I'd be done for. I would be walking around with the risk of death at my shoulder, literally. And when Medicare finally decided to negotiate prescription drug prices, they brought down the expense, I think, to something like this year. The most I'll have to pay for the whole year is like $2,000. That would not be, everything else is covered by my, drug care, Part D plan and everything else. And I think that what you mentioned is so important. The idea that the government should use its levers to give senior citizens more affordable, and everybody more affordable health care. But the other is more of a question. I'm applauding you as to the first issue. But the second issue, I think your overall thrust is exactly right. But how do you invest as a state in these kinds of like preventative health care? Is it through direct subsidy of physicians or medical schools? How is the most effective way of doing this?
Yeah, so a couple of things. New Jersey has some of the lowest reimbursement rates for primary care in the country. Not just Medicaid, but also our commercial market.
Right.
We also have a very antiquated licensing system, and we don't collect enough data of who's actually practicing medicine in the state, and then the demographics of that, like where they're practicing, the type of facility, their age, their race, ethnicity, languages spoken, how many more years they intend to stay in the state and practice. If we had a lot more of that information, we could be doing a better job of investing in our programs to develop and keep more of the graduates here. We could be investing in tuition reimbursement programs to incentivize more people to go into the types of practice that we need. There's all different things we could do if we had just basically a more functional licensing system, and one that provided us with a lot more data. Other states do a much better job of that. Oregon and Washington come to mind. New York's doing a lot of work in that. The Quality Institute actually released a report with a lot of recommendations around updating our licensing system and supporting better programs to recruit and retain people here. But it's really just improving the climate for people to go into primary care and to better reimburse them for going into primary care, mental health, pediatrics, things like that. Really, a lot of the services that we need more of here in New Jersey.
So your focus is on making more incentive for providers in these areas, and they can.
Yeah, it's incentives. It's also, it takes a long time to get your license, to get credentialed. A lot of our systems to do that are not as modernized as they need to be. There's a lot to it, but we could be, I'd say, a friendlier state when it comes to getting somebody set up and licensed and working here in the state of New Jersey.
I've heard this complaint from physicians. I'm somewhat sympathetic to them. Years ago, I was dealing with spinal care physicians. It's a very, I wouldn't go into spinal care for, first of all, your malpractice insurance is going to be off the charts when you go into something like that. And, the rates of reimbursement, as I recall, this is all the way back, in the second decade of this century. The question was, how could they get a better rate of reimbursement? I think that what your focus on reimbursement for a lot of these areas is going to be very, very critical. And I assume that this is something you're going to be discussing with the various candidates for governor and legislature as we get into the election season.
Yes, yes.
What I'd like you to do so that I'm more aware of these issues, I'd like you to send me, if you can, digitally, okay, any of these publications, because I will read up on them, because I want to have an idea as to what you are providing for these candidates, so I have an idea as to where they're coming from, because I'm having all the candidates for governor come on this show. And I've had a pretty good success rate at getting them to come on. But I think they're going to have to focus a lot more on healthcare, because everything I hear from the candidates, I'm not being critical when I say this, everything has to do with affordability, but too often the concept of affordability is limited to taxes, and that's it. Affordable housing is a component of affordability, but medical care is a big component.
Sure.
And if they're going to be able to make an appeal to the voters about health care, they're going to have to really get an education. And they don't get this education. I'm not being disrespectful of legislators. I worked with the legislature for a long time, and I have formed serious friendships there. But they're not going to just get this by studying a few bills. They have basically what I would call continuing medical education, and I think that you are in a position to provide this. So I hope that you have a receptive audience when you're talking with these candidates.
I think we will. We've worked with many of them in the past in various capacities, and we saw that when in the last election we provided a lot of our resources again on both sides of the aisle, and whoever the next governor is going to have a lot of challenges when it comes to healthcare on their plate, and anything we can do to help will be we're happy to do so.
Well, I think that healthcare is an issue that goes beyond political ideology. Right now, in all your major countries of the world, countries that are major democracies, I would say, healthcare is now considered, as it should be, a right. And in
Yes.
order to make it a right, though, it reminds me of a story years ago. I was living in Camden County, and I've used this saying quite a bit with people. There was Camden City had real rough and tumble politics in those days, the late 70s, actually the late 60s, early 70s. And I once was talking to a political leader, and I was very naive. I was trying to get him to back a candidate that I liked. And he says, well, how much money does your candidate have? He says, because there ain't no finance, there ain't no romance without finance. I'll never forget when he said that to me. And I felt like the most naive person in the world after he said that to me.
Jersey.
But it's true. I mean, all these matters involve public monies. All these matters involve priorities, and all these matters involve really bringing it to the attention of people. There's a new book out by Chris Hayes, the MSNBC commentator, where it's called something to do with, he calls it the Siren's Call. And it's all about people nowadays have the internet. Everyone's competing with the attention of people. I think the goodness of your organization is your ability to get them to pay attention. And I'm rooting for you folks in that vein.
Well, thank you. Thank you. No, I appreciate the spotlight and the time. And yeah, I don't think that any of these candidates are going to have a choice when it comes to healthcare. They're going to have to pay attention to it because it's what's going to break the budget. So I think if we have answers for them, which I know we do, they'll be talking to us, and that's what we want.
Well, I'm going to drive you crazy because I'm going to ask you to come back on the show after we receive the details of Trump's proposals on Social Security and healthcare, because at that point, we will have something tangible we are dealing with or not dealing with. So
Okay.
I hope you can find the time to come back, because you're serving a real public purpose by going on podcasts and television shows like this, and you do a very good job. So I hope to have you back.
Sure, be happy to. Let's talk between now and June 30th. We'll see what New Jersey's going to do to get ourselves situated in the right way on this, because it's a significant risk for sure. This is real.
It certainly is. And Linda Schwimmer, I want to thank you for coming on our show tonight. It has been most instructive, and it's been an excellent education for our listening audience. And again, I wish all the success in the world for the New Jersey Healthcare Quality Institute, a organization, a 501c3 that really is one of those that I can say works in the public interest. And we're all about the public interest on this podcast. So I thank you, and I wish you all the best, both professionally and personally. That concludes our show tonight. I'm delighted that you joined us. I finally stopped wearing green this week. I was wearing green for the Philadelphia Eagles, and I'm back to normal dress. But we have some excellent shows coming up over the next few weeks with gubernatorial candidates, with professors talking about the factors in this election, and from policy experts like Linda Schwimmer. Thank you very much for attending this podcast, and look forward to future shows with our listening audience. Take care.
Thank you for joining us for the latest edition of Dynamic Political Centrism. Check back each week for our newest episodes, and you can catch past episodes online via YouTube and Spotify, and please subscribe to our Substack.